Hi, we're here today to talk about COVID-19, which is spread across the globe and is now a big concern for people in the United States. Here in Central Ohio, the situation is changing daily in terms of organizational and government actions to address the spread of the virus. We're here today with Dr. Matthew Washam, Chief of Epidemiology and Infection Prevention at Nationwide Children's Hospital. He's going to help us answer some of our frequently asked questions about the virus. Dr. Washam, first of all, can you tell us what COVID-19 is? Is it just like the flu?
COVID-19 is a novel virus. It's a new virus. It's a coronavirus that is a virus that is new to humans, so it has spread from animals to humans. There are common coronaviruses that are common causes of upper respiratory infections in children and adults. This is a different virus than those coronaviruses.
Okay.
It's a novel coronavirus.
So it's like the common cold, but bigger?
It's yes, but because this is new to humans, we have no pre-existing immunity towards this virus, and many people can be susceptible towards this virus.
Okay, so what are some of the symptoms of COVID-19?
Symptoms of COVID-19 are fever, cough, respiratory symptoms, minimal upper respiratory symptoms such as runny nose, but it's predominantly fever and cough.
Okay, it's mid-March, it's allergy season, still in the tail end of flu season. How can I tell the difference if I think I might have COVID-19 or if it's just allergies or a cold or the flu coming on?
So good question. There's a lot of overlapping symptoms between all three of those: allergies versus another viral illness versus COVID-19. Seasonal allergies, it would be unusual to present with a fever concurrently with it. Other viruses can present similarly to COVID-19. Influenza tends to strike a little bit more abruptly, so symptoms come on more abruptly than COVID-19 does. There is still much to know about exactly how COVID-19 presents in children, the signs and the symptoms. It does appear to be more mild in children than in adults. However, there are overlapping symptoms between the two.
Okay. So how do I know when I need to get tested or when I need to get my child tested?
Currently, right now, we're recommending that if your child is well, to stay home. If there is a strong link to an individual or an exposure to an individual with laboratory confirmed coronavirus, the novel coronavirus COVID-19, or if a family has recently returned from travel to an area where there is widespread transmission, those could be reasons to test. But testing does not, there is no treatment for this virus for mild symptoms. Testing does not change how the outpatient management would be.
So if my child or I am exhibiting some symptoms and they're not really mild, they're in that moderate to severe range, should I call my primary care provider, go to an urgent care, or should we just automatically go to the emergency department?
I think the first step is if you have concerns about your child, depending on how well they're doing, if there are concerns about dehydration, if there are concerns about breathing status, the first thing to do is either to call your child's pediatrician or family physician to discuss, or depending on level of concern, seek care. If you're concerned that this could be a life-threatening situation, then call 911. Otherwise, you can take to the emergency department. If you have concerns that your child might have COVID-19 because you've either just recently traveled or you have had close contact with somebody who's been diagnosed with it, then call ahead of where you are going to let them know that you are coming in and your child might have COVID-19.
So my child's well. He just had a birthday. We have a well visit scheduled. I know lots of families have appointments, regular follow-up appointments scheduled, well visits, checkups, that sort of thing. Should we keep those or should we be looking at rescheduling those?
At this time, continue to keep currently scheduled appointments. We are looking into ways to decrease to separate our well visits from our ill visits. In the upcoming days and weeks, there are many pediatricians' offices, and here at Nationwide, we will be trying to keep those that are well away from those who are ill to the extent possible. At this time, though, I would not recommend rescheduling any of those appointments, but in the near future, that might be a consideration.
So how can I protect my family from COVID-19? example, wearing gloves, wearing a face mask out in public. We've heard a lot about hand washing. What is the best way to protect my family?
The best way to protect against your child or anyone else in your family from acquiring COVID-19 or any other respiratory virus is to make sure that you're washing your hands, to make sure that you're staying away from those that are ill. If there's somebody in your family or household that has a cough, practicing good cough etiquette, coughing into the shoulder or wearing a mask or coughing into a Kleenex, is wiping down frequently touched surfaces within the home with just standard household cleaner, and then avoiding large areas where there might be individuals who are ill. So social distancing is now a new topic and a new word that's now no longer new to many people, but that is a way to help prevent the spread of this infection through the community by having large crowds avoid congregating together at the same time.
So you mentioned social distancing. Schools are closed here in Ohio for the next 3 weeks. We've heard on the news that this disease typically is more severe with older populations. How will closing schools or keeping children kind of in that social distancing approach, how will that help?
All of these efforts implemented by the health department, by public health, they're all ways to stop the spread of the virus through our community. So by preventing large groups of individuals from assembling together, from compiling together, you help prevent, if one individual is ill in that group, from spreading it to many others at the same time. By doing so, even if children thankfully appear to be minimally affected or less affected than elderly individuals at this time, that by limiting the number of ill persons in a community, you therefore prevent potential exposure to your most at-risk individuals.
So worst case scenario, someone in my family gets COVID-19. How can we protect the rest of our household?
That's a challenging question. The best thing you can do is to try to limit the number of direct care providers to an ill individual in the household. Oftentimes that's simply impractical to do, but if it's possible to have one individual or as few individuals caring for that ill child or adult as possible, to limit the extent of the exposure between other household members with that ill individual, so keeping them isolated to the extent possible within a room. Again, that would be a good time to ensure that you're wiping down frequently touched areas in the house. If that ill individual needs to come into common areas like the kitchen or the living room or family room, to have that sick individual wear a mask. All these things can help limit the possibility of spread.
What is Nationwide Children's doing to prepare for COVID-19?
Nationwide Children's has been preparing since very early on after the announcement of the first cases in China for how to prepare in the event that there would be children presenting to our healthcare network with potential COVID-19. We have ensured that we have adequate supplies necessary to protect our staff, that we have processes in place so that anybody with suspected disease is placed in appropriate isolation, and that we make sure that our staff is educated on what are the right steps to do, as well as our families as well.
Here at Nationwide Children's, we take care of a lot of really sick or kids with complex medical needs. Are there any special precautions that we're taking to protect them, or for families who have these kids at home, are there any special precautions that they should be taking?
Individuals who have higher risk household members, and that includes many of our families, but also families with who care for elderly individuals in their household, or for those with suppressed immune systems, there are some steps that you can take. So again, it's similar to what everyone can do. So washing hands, practicing cough etiquette, avoiding those who are ill, washing highly touched surfaces throughout the household. But then also for high-risk individuals, now is not a good time to go on a cruise. Now is not a good time to travel internationally. It's really trying to limit your exposure to large groups of other individuals. And so now is probably not a good time to go to a large concert or other venue where there's many people crowded together in a confined airspace.
I know there's a lot of feelings of anxiety that might be cropping up for people. How worried do we need to be for our families?
It's very challenging in times like this when there's lots of unknowns. It's a natural instinct for people to have fear, to have panic. That's the reason why it's hard to find many food staples on the shelves at this time. Many people just don't know what the future is going to hold. But it's important to know that the health department, large institutions like Nationwide Children's Hospital, that we're doing everything in our power to try to slow the spread of this virus and to keep everybody safe. And some of those things, the social distancing help prevent the spread throughout the community. But it's important in times like this and with lots of unknowns is to remember to stay calm. If you have questions, then contact your primary care provider for guidance. Nationwide Children's also has many educational tools available that will be there for families as well. But it's to stay calm and continue to practice good hand hygiene and good infection control practices.
As the situation continues to change, we encourage you to go to nationwidechildrens.org and search COVID-19 for a website with the latest information and news you need to keep your family safe.